Hey everybody, Dr. Barron here with virtualheadacheспecialist.com. I want to talk today about the triptans, and the triptans were really a groundbreaking new migraine abortive medication. The first one came out in 1992 with sumatriptan. There are 7 triptans available. They activate the serotonin 1B and serotonin 1D subreceptors. And what this means is that when you activate the serotonin 1B receptors, this causes constriction of blood vessels, and we know in migraine there's some dilation of blood vessels, so they constrict those vessels back down. Activation at the serotonin 1D receptor will interfere with the electrical signaling of the migraine to attack itself. So how do you choose which triptan is best for you? I'm going to go through some tips on how you and your doctor can really fine-tune what triptan might be best for you based on your personal migraine features. Because migraine can present differently, and you can really get a strategy to better fine-tune treatment for that. So first I want to break the triptans into 2 groups. The group 1 triptans have a faster onset of action. They have a higher potency, which means that there may be more potential for side effects. They do tend to have a higher 24-hour migraine recurrence. These are sumatriptan, zolmitriptan, rizatriptan, alomotriptan, and elatriptan. The group 2 triptans have a slower onset of action. They have a lower potency, which means they tend to have less side effects than the group 1 triptans. They have a lower 24-hour migraine recurrence because they do have that longer duration of action. These are the triptans such as vour and naratriptan. So how do you fine-tune your triptan choice? The way that I think about this is I want you to picture a piece of corn. So if you think of the mnemonic corn, this can really help to fine-tune the triptan to your specific migraine characteristics. So first of all, C for corn is contraindications. So you want to talk to your doctor, obviously. If you're using a triptan, they'll know what's safe for you. In general, any kind of vascular disease like coronary artery disease, peripheral arterial disease, stroke, uncontrolled vascular risk factors like high blood pressure, these would be considered contraindications to triptan use. What about the O for corn? So O is for onset to migraine peak pain. So for these migraines that come on very quickly, you want a group 1 triptan because they have a quicker onset. These are going to be more useful in general than a group 2 triptans, which have a slower onset. Subcutaneous injection or a nasal spray triptan typically are going to be more effective than an oral triptan if you have waking migraine. You know, waking migraine is tricky because you wake up, you're behind the ball, so you need something that's going to work quick. Or if you hit peak migraine pain within 30 minutes. So a very fast onset, you want a some kind of a group 1 triptan generally. R in corn is return of migraine after treatment. So if you have a migraine that continues to come back within 24 hours, so say it goes away with the triptan, keeps coming back later in the day or the next day, and you end up with this multiple day event, or even things like menstrual migraine, you want to use a group 2 triptan, so like naratriptan, vour. You can also sometimes combine the first dose of a group 1 triptan with an anti-inflammatory such as naproxen, and there's actually a combined triptan naproxen called Trexamet that does this. The N in corn is nausea and vomiting severity. So if you have nausea, vomiting early in the attack where you're not going to be able to keep a pill down, you're going to need a injectable triptan or a nasal spray triptan. And a note here is that the dissolvable tablets, there's a couple dissolvable triptans, they're still absorbed by the GI tract. So they're not absorbed sublingually, which is a misconception. So if you're vomiting, you're still going to vomit that up. It's still going to be ineffective. So you're really going to need an injectable or a nasal spray to get into the bloodstream without going through the GI system. Some additional triptan pearls to further fine-tune based on some of the specific triptans. So sumatriptan overall has the highest potency. In its subcutaneous injectable form, it has the quickest onset in its subcutaneous greater than nasal spray form. It has the greatest flexibility in dosing route options. Rizatriptan has the fastest onset of the oral triptan, so it actually kicks in a little quicker than oral sumatriptan. You have the greatest likelihood of 2-hour pain freedom and sustained pain-free response with this. If you're using propranolol for prevention, you have to remember that you want to use the 5 milligram rizatriptan with it rather than the full dose because of an interaction. Zolmitriptan is the most likely to treat persistent headache if the first dose fails. Almatriptan is the group 1 triptan that has the least side effects. Elatriptan does have the highest potential for drug interaction, so you want to use the lower dose if you're using CYP3 for drugs, like some of the antibiotics, like the macrolides, antifungal drugs, HIV drugs. Naratriptan is known as the gentle triptan. It really tends to have the least side effects overall of all the triptans. It has a low 24-hour migraine recurrence. It's a good choice to give shortly before some kind of an expected or known trigger like menstrual migraine or air travel, things that you know is going to trigger a migraine. Frovatriptan also has very low side effect potential because it also has a slow onset of action. It does have the longest half-life of 26 hours, so you have, again, low 24-hour migraine recurrence, and also a very good choice to give shortly before some of an expected trigger like menstrual migraine or air travel, stressful event, those kind of things. So anyway, just some tips you can talk to with your doctor and hopefully will help you to fine-tune to finding a better triptan. All right, take care, guys. Bye.